There are many different types of cases associated with pharmaceutical misuse and abuse. They range from drug diversion and doctor shopping to illegal prescribing by rogue physicians. The one thing all prescription drug cases have in common is they often take a lot of time, resources, and personnel to investigate. Almost everyone is impacted by prescription drug activity in some way. It involves all ages and demographics. And in the United States, the number of deaths involving prescription drugs is increasing at a steady rate. There are many factors influencing this, including the relatively easy access and availability of prescription medications, the carefree recreational aspect of using them, and the misperception that they are somehow safer than traditional street-level drugs. Investigating any type of pharmaceutical drug case is paper and documentation intensive and often involves teamwork and partnerships.
The biggest expenditure for any agency is going to be personnel time committed to any one case. And if that case is lengthy, for any 6 months to a year or longer, that's a lot of time you have wrapped up in an investigation. When you start looking at the complexity of any case and you see it starting to branch off to other criminals that may be involved, it's going to require additional personnel to help you with those investigations, as well as the time.
Drug diversion is a term to describe the more common prescription drug crimes. It is the illegal movement of legal drugs and ranges from a single incident of prescription fraud to racketeering involving multiple people and incidents. Sometimes it is difficult to determine if an action involving pharmaceuticals is legitimate or fraudulent without further investigation.
If you're looking at any potential doctor shopping case, prescription fraud, or even a questionable practitioner, as you start to look at it closer and through the totality of all the information you would obtain during your investigation, hopefully you'll be able to determine if it is legitimate or not.
Doctor shopping is when people visit multiple doctors to obtain prescriptions for controlled substances. They are often referred to as drug seekers. The doctors are not aware their patient is seeking treatment from other physicians and writes a prescription for a controlled substance. The patient then goes to different pharmacies to fill their prescriptions in an effort to cloak their activity. Most times the patient obtains the drug for their own use. Often they sell some of the pills to feed their habit or fund their addiction or lifestyle. State laws may vary in their definition related to the criminal act of doctor shopping, so make sure you know what is in your state statutes. Doctor shoppers are often very good actors and work to deceive healthcare providers and pharmacists. Sometimes they claim their pills were lost or stolen so they can get a new prescription. They often pay in cash and live outside the area. They complain of extreme pain and request a certain brand, dosage strength, or amount of a specific drug.
Well, the traits can vary depending on what is the motivation for the individual who is obtaining pharmaceutical pills. Is it because of the addiction? They're using it because of greed, or they're selling those items to make money. So as you start to look at these individuals and look at their background, hopefully that will give you a clearer picture as to the type of individual you're dealing with.
The criminal charge for trafficking of a prescription drug exists for only a few select prescription drug compounds. These cases are based on the weight of specific drugs found only in the Schedule II Controlled Substances classification, like oxycodone, hydrocodone, hydromorphone, and others. There are no trafficking charges for most controlled substances besides the mentioned few in Schedule II. That means there are no trafficking charges for drugs like alprazolam, methylphenidate, and most others. State and federal courts view and calculate weight for trafficking charges differently, so make sure to understand the differences in your area.
Well, you need to understand your state guidelines and your laws in those individual states for a number of reasons. Not every state has a minimum mandatory charge, so before we usually take these cases to either a local, state, or federal prosecutor, we'll look at all the elements in the case as to what they did, and then that will kind of maybe give us an indication of where we're going to try to bring that case to an appropriate prosecutor.
Prescription fraud is another type of case we see as investigators. It's when someone obtains or attempts to obtain possession of a controlled substance by fraud, forgery, deception, subterfuge, or misrepresentation. Most state laws are similar in their language, although they may differ in the crime classification, whether the charge is a misdemeanor or a felony. Most script fraud charges involve either an electronic or written prescription order that has been falsely created or an actual prescription that has been altered in some fashion. The prescription is then presented to a pharmacy for filling. In an effort to combat prescription fraud, many doctors' offices are electronically transmitting their prescriptions directly to a specific pharmacy for their patients. In these cases, the pharmacist becomes the last line of defense.
I think it is law enforcement's role to help them, if anything, to give them what I would call helpful hints, things to kind of be on the lookout for. So if they see an indicator or a multitude of indicators, that will prompt them to take a little closer look at something they think is out of order and maybe contact the physician or contact law enforcement. There's no harm on being safe.
The types of cases we have talked about usually involve a drug user who is obtaining drugs for self-abuse and profit. There are also cases that involve doctors and pharmacists who, for no legitimate medical purpose, illegally prescribe and dispense prescription drugs, mainly for profit. While most doctors are good people who vow to do no harm, there are some who are basically drug dealers in white coats. We call them rogue physicians, who are more interested in profit than in patient health and safety. They often run clinics or medical facilities that prescribe or dispense controlled substances in large quantities to large scales of individuals in a cookie-cutter fashion without regard for the potential for addiction or patient safety. Several years ago, these illegal practices were rampant across the U.S. and often were very easy to spot. They were identified by long lines out the door, cars with license plates from other states, complaints from neighboring businesses of drug use and seedy-type activities, and the people paid in cash, large amounts of cash. The physicians who work inside them often make a lot of money and do little or no medical intervention for the patients who come to see them. Drug seekers know these doctors will prescribe them what they want. Times have changed.
No longer do they want the attention, so they won't allow for the long lines anymore. They may tell you that you have to give a phone number, they will call you to come back, or direct you to a parking lot, kind of a cell parking lot, and then in a certain amount of time they will notify you to return. These are just some of the many tactics that these questionable places have now moved to, because again, they want to stay below the radar and out of the sight of law enforcement.
Even though these illegal practices often look like legitimate offices, they often operate just within the law and comply with basic regulations. But investigators need to remember that not all pain management clinics are pill mills.
We're not into it for just driving around and trying to pick out which are the good doctors and which are the not good doctors or practitioners. Usually we'll receive a complaint or a multitude of complaints, and once we start to look a little closer, we'll start to see more indication that there are potentially a problem there.
Dirty doctors and pill mill cases are very time-consuming and difficult to investigate, and even harder to prosecute. Most healthcare practitioners have no criminal history and often have a legitimate portion to their medical practice. This provides an air of legitimacy to their actions, forcing the investigator to prove the difference between a bad medical decision and a criminal act. Many other types of crime are linked to pharmaceuticals. There are pharmacy and other types of robberies and burglaries, DUIs and vehicle accidents, domestic violence and drug-endangered children cases, insurance fraud, Medicare and Medicaid fraud, identity theft, money laundering, and many more.